Actually, we're going to get to Governor Newsom right now with his news conference underway.
Over the course of the last number of months about testing, not just here in the state of California, but all across this country. California, as you may recall, was testing about 2,000 people every month for the beginning of April. We've been able to increase our testing capacity substantially over the course of the last number of weeks, from 2,000 a day to over 25,000 tests a day. In fact, over the last 6 or 7 days, those numbers have increased to roughly 30,000 tests a day. All told, the state of California has tested north of 800,000 people. We have a lot more work to do, but the work of our testing task force has been very, very successful, particularly in not only addressing the needs in the aggregate, but beginning to focus our testing strategies in a much more strategic way, specifically focusing on rural areas in the state of California and on inner cities, to make sure that we're truly testing all Californians, not just some Californians. We mentioned a week or so ago some new contracts, some that are being expanded, some that were new. OptumServe, which was going to provide 80 sites in rural parts of the state. Verily, that first mobile testing site we announced over a month ago in partnership with Google. We announced their commitment to do 86 additional sites throughout the state. We're able today to launch a new site called COVID-19, not new site, well-known site, but a site that allows you to drill down and get more information about these testing sites if you go to covid19.ca.gov. If you go to the covid19.ca.gov website, you can now find the location by simply pressing in your zip code. You can provide more information if you wish, but if you just start with the zip code, you'll see these testing sites come up on a map. You'll see it through OptumServe, you'll see it through Verily, and through the community sites that we have partnered. The sites that are not included in this map are additional testing sites at hospitals, but these are the sites that the state has contracted that are proximate, we hope, within 30 to 60 minutes, depending on where you are in the state of California. I recognize there are still some testing deserts, and we have work to do to put more flags on that screen that you just saw, but we are making real progress in this space, and we hope you take advantage of not only going to this site, but getting your zip code inputted, and then potentially, to the extent you wish, making a reservation, contacting that community tester, contacting Verily and or OptumServe, and those are prompted on this site, and so you can literally make direct reservations for testing off the covid19.ca.gov website. So that's a new tool we wanted to socialize today, make it available to you. Again, we still have an enormous amount of work to do. This site will expose that, but in a very transparent way. We've been very forthright in our recognition that we need to spread out our testing capacity and also deepen it in certain communities. This site will show the areas where we still have work to do. Again, it doesn't include the hospital-based system, so that's just something for consideration, but does give you a sense of what is out there, and also a recognition that there still are some testing deserts in the state, and we hope in real time through the good work of our testing task force to make sure that we avail opportunities for everybody in those areas as well. Another thing we've been working on is we moved with the announcements earlier this week to discuss reopening our economy with modifications, reopening sectors of our economy with modifications, and adapting and reopening parts of California, regional parts of California, with modifications, with variances based on criteria. That fundamental point that we needed to advance was the protection of our workers. A few weeks back, you may recall an announcement where we advanced support for workers in the food chain, from farm workers to the folks in the front lines, the grocery lines in the state of California, through expanding paid sick leave. As you may recall, the federal government provided sick leave expansion for employers less than 500, but not for some of these larger chains and their employers. In the state of California, we augmented that with the announcement we made a few weeks back with paid sick leave through that food supply chain. There were others, though, that were left out of that support, quite notably out of federal support. And those are the folks, the healthcare workers, the folks we rely on the most, and many of our first responders, firefighters, paramedics, as an example. They were left out of the original sick leave announcements from the federal government and were not part of our previous announcements until today. I just signed an executive order to extend benefits, workers' comp benefits, in those sectors and now broaden it beyond just the healthcare and first responder sector to all sectors of our economy under what we call a rebuttable presumption. That may be confusing to some, except to say this. If you've tested positive or been diagnosed with C-19, with COVID-19 by a physician, you are eligible for this workers' comp benefit. It can only be rebutted by your employer, but under strict criteria. So this is a way of providing support to our critical workers that are essential in our capacity, not only to meet the needs of people today, but as we begin to enter into this new phase and start to reopen our economy, are essential for our capacity to deliver on the services that we want to expand and increase across the state of California. So this is I can assure you, without getting into the weeds, the sausage making here, people are very passionate in this space in terms of what they want to see. But this executive order will narrow the frame and at least provide some certainty of relief on this presumption for the next 60 days. It has a retroactivity to March 19th, but extends for a 60-day period and should provide some calm and relief to our healthcare workers that were otherwise scratching their head wondering why they weren't part of some of these original announcements, both at the federal level and at the state level, and I think do justice to the incredible heroism, particularly on National Nurses Day here in the United States of America, to say thank you to our nurses, thank you to our frontline heroes, thank you to our firefighters, paramedics doing CPR and the like. Thank you for a job well done, and this is the least we can do in terms of targeting that support on a rebuttable presumption for your workers' comp. Again, the whole idea is as we move into this second phase, we want to keep workers healthy and keep them safe. The worst thing we can do is have a worker that has tested positive but doesn't want to tell anybody and can spread the disease because he or she can't afford not to work. And so that's why expanding to all sectors of our economy, this workers' comp presumption is so important, because we want people to feel confident and comfortable they'll have their benefits. Of course, these are benefits after you've already exhausted and drawn down any federal benefits you otherwise may have accrued or other state benefits. There are provisions, there's a criteria we lay out in this executive order, but I think it's a very healthy step in the right direction, critical step in the right direction as we move into this phase two. I'm pleased that we have our Director of Department of Industrial Relations, Victoria's here today to talk a little bit more about this program. It's part of her larger, and you're probably wondering what Department of Industrial Relations is, but among many other responsibilities Victoria has is making sure that our workers' comp system is working, is operational. She has been working overtime with industry leaders, business, as well as labor leaders all up and down the state, and trying to forge, to the extent we can, a framework of understanding and capacity and appreciation to be able to make this announcement today. I'd be remiss if we didn't ask her to come up and talk a little bit more about this program and talk a little bit more about how you could avail yourself of more understanding and a knowledge about what this means potentially for you.
Thank you so much, Governor Newsom, and for your great leadership in this space. As we know, workplace health and safety is public health and safety. This benefit applies to all workers, all of those frontline workers that are risking their health and safety to ensure the health and production of all of us, our nurses, our first responders, janitors, warehouse workers, farm workers, grocery store workers, and all of those that are putting themselves on the line. This ensures that if you test positive or are diagnosed with COVID-19 that is later confirmed through subsequent testing, and you report to work between March 19th and 60 days from today, and that positive test or diagnosis is within 14 days of reporting to work, it is presumed that you contacted COVID-19 through the course of your employment, and you are covered under workers' compensation, ensuring you have proper medical coverage and proper benefits. We have ensured that there are strict criteria to ensure that we are protecting worker health and safety, that employers have the ability to present evidence in the case that it is discovered that a worker does not have COVID-19 or that they did not contract it at work, and that we're able to quickly ensure that workers are protected, they're able to get better and return to work safely for the betterment of all. And we will be issuing additional guidance in the coming days to help provide greater clarity. And thank you so much to all those frontline workers for all the work that you are doing throughout this crisis. Thank you.
Thank you, Victoria, and thank you to your team for organizing this program and getting that executive order to my desk earlier today.